I recently had a gentleman, a CEO of a company, coming to me saying that both he and his wife went to a holiday, and suddenly he found that he was getting an intense headache, and when they checked in the local area, his blood pressure is very high. And he also noticed that in last 1 month, he gained about 4 and 4.5 kgs of weight, which is completely unusual for a CEO who always used to do a fitness freak. And with its intense headache, when they checked the blood pressure when it is high, both of them started panicking what exactly was happening. And luckily, when he returned to the Bangalore, when he was tested, one of the hormones in his body was found to be very high. It is called cortisol hormone. This is the same hormone which causes stress to all of us. So that's why under stress, the cortisol goes up, and cortisol creates not only body weight increase, it mood swings, high blood pressure, and so many problems. But why a cortisol should be high in a 32-year-old gentleman who's a fitness freak? And when they investigated, they found a small tumor in a place called pituitary gland, which is growing so badly that his hormonal level was 10 times more than the normal people. In a normal people, it is less than 5 microgram, and for him is almost about 50 milligram. And what is the treatment for this? The treatment unfortunately lies that the tumor has to be removed from the pituitary gland. This is one example. This is another example. I had a similar kind of another girl, very pretty looking girl, once again IT professional. She said, "Doctor, I'm not having a regular menses for last 3 months, and I'm also occasionally finding, though I'm not married, milk secreting through my breast, which is annoying me, and my menses, which was regular last year, has completely come to halt." And when we investigated this once again with the MRI, which is very common in the hormonal profile, her prolactin level is very, very high. The prolactin level usually stays between 20 to 30 milligrams in these patients, normal people. For her, it is almost about 150 to 200. That is called a prolactinoma. So in general, the pituitary gland is a small gland. Sometimes the cells in that multiply and produces what is called pituitary tumors, which are hormone secreting pituitary tumor. And nothing to worry in these patients. In a first patient, it is a microadenoma. I removed the tumor through endoscopic approach through the nose. Believe it or not, the weight reduced 4 kgs in less than 10 days. His blood pressure normal. He was back to work. That other girl where the prolactin was very high, I did not even do the surgery. Gave a medication to suppress that, and she started having a menstrual cycle, and she's back to normal. So the pituitary tumors, hormone producing tumors, are rare, but when it is there, it should be investigated and treated accordingly. And at Aster Whitefield, we have a separate neurosurgical brain tumor center where even a slightest doubt, we diagnose thoroughly with MRI, and with the newer technology, you can diagnose very well and treat it easily to make you comfort. Welcome.